pelvis muscles are separated by a fibrous connective tissue that's about 1/2 inch wide, and it's called the linea alba. Okay, so it's this line right here that runs up and down the belly. And it really needs to have a certain amount of elasticity to accommodate the growing belly. However, as the belly grows and the abdominal stretch, they do become weaker, which can result in lower back pain or diastasis recti. Okay, so diastasis recti is the separation of the linea alba. It's the fibrous piece of tissue which softens and stretches around the growing belly, causing it to weaken, stretch, and separate. So this can happen in the 2nd or 3rd trimester. Strong abdominals and lower back muscles, as well as good posture, are going to help prevent this from occurring. And if the abdominal muscles are really tight, it can make it even more difficult for the baby to get into an optimal position for childbirth. So the key really is moderation, and poses that engage abdominal muscles that have like a crunch style are totally contraindicated.
Because it would make the muscles too tight.
Yeah.
Got it.
Okay. Too many questions?
What about something like tiger pose? Vyagrasan.
I think, done gently,
Yeah.
it's okay. But again, if you're pulling that knee all the way to the nose, then that's going to be a little bit too much. But at the same time, you do want to strengthen the lower back. Mm-hmm. You do want to keep the belly muscles,
the hips too,
strong, because if you have strong abdomen to help carry the baby, that's going to really help relieve that discomfort in the lower back. And also strong abdominal muscles, they're going to help in delivery when to push the baby out. Okay. Strong abdominal muscles is going to be helpful for the digestive system. And, the diastasis recti, the separation, it's pretty rare, but it can happen if you don't have some kind of tone in there. It can happen either if you're too lax in abdominal muscles or even too tight, it might separate. So, okay. So the back muscles, that added weight of pregnancy pulling the body forward, can cause, again, that anterior pelvic tilt, but extreme, so hyperextending the lower back into that sway back, which can also lead to a lot of lower back pain. So it's important to remember that the natural curves of the spine do change because of pregnancy, but we still want to maintain the natural pelvic tilt. We don't want to force the spinal curves into proper alignment by encouraging that pelvic tuck. We still want a little bit of that anterior pelvic tilt to, again, encourage that optimal fetal position. But there needs to be some kind of awareness. For me, it was having a little bit of abdominal lift in that lower belly, a little bit of like mula bandh to lift up and to sense that I'm supporting the baby, but not so much that I'm tucking underneath. Because again, the overly tucked tailbone encourages the baby to move towards the back of the pelvis, where there's a lot less room for the baby to turn around, and discourages that optimal fetal position. If there's pain in the lower back, you really want to encourage the lengthening of the lower back. Again, the strengthening of the abdominals, strengthening of the rector spinae muscles that run along the spine, and to get that lengthening to help decrease compression. But the pubic bone should stay lower than the sacrum. Okay, so a couple examples of this might be doing like cat pose or Majarasana. Well, kind of like tiger pose, but maybe it's like the legs just straight reaching back. And, maybe even balancing it a little bit with the one arm reaching forward. or even taking Eka Padasana, is a one-footed pose, but maybe at the wall with one leg reaching back, so wall for support, to get that strengthening through the lower back, but also the lengthening. Even doing maybe even doing Sphinx pose, but with bolsters underneath the thighs and maybe blocks underneath the forearms, since you can't be on the belly.
Yeah.
Yeah. Okay. Any questions?
What can you safely do everything in the first trimester?
Yeah. I mean, actually, what's interesting is that it's, depending really on what tradition you're coming from, people have different opinions on that. From the Satyananda tradition, you can pretty much do everything in the first trimester. It's just staying mindful of your body. Yeah. Yeah. Okay. So moving on, let's talk a little bit about the cardiovascular system. So the body is made up of about 70% fluid, and because of the relaxin, that's gonna all the muscular walls, the blood vessels, the lymph vessels, everything softens, and so as a result, the fluid content in the body goes up, and so it said that half of your pregnancy weight gain is fluids. So that's why you might see some conditions like it's called edema, where the legs are swollen. That's from that fluid, that rise in fluids in the body. This also makes the heart have to work a lot harder to distribute that extra blood throughout the body. So the blood volume actually increases from 40 to 45%. The cardiac output, the amount of blood pumped by the heart, increases 40 to 50%, and the resting heart rate increases 10 to 15 beats a minute.
Wow.
So all of this extra blood can lead to circulatory problems, including, again, we said that edema, and then also varicosities. So varicose veins, yeah. This might account for the breathlessness that women feel during pregnancy, classes, or even just doing the vinyasa, so moving through the sun salutes. This might be more difficult to do it just on one breath at a time, so slowing things down. Holding poses for a long time that do not emphasize muscular contraction can slow down circulation. Gentle vinyasa, gentle kind of flowing in and out of poses that do emphasize muscular contraction of the limbs can be really beneficial for circulation. It's like Palmuktasana series. One would be great. And starting around the 4th month, so around 20 weeks of pregnancy, when a woman is lying down on her back, the uterus can put a lot of pressure on the vena cava, which is the vein that returns blood from the legs to the heart, causing dizziness and slowing the blood flow to the fetus. Okay, so that's why, I don't know if you've heard, pregnancy don't have them lie on their back.
Right.
So the vena cava is a little bit more to the right, which is why pregnant women are usually told to lie on their left side.
In Matsya Kridasana.
Yeah. Exactly.
That's pretty much the only one that pregnant women can do. Is flapping fish, really.
Well, just even just
lie on their stomach
or just a sideline pose.
Yeah.
Yeah. So again, around 20 weeks, there's that potential for blood flow to decrease due to the weight of the uterus on the inferior vena cava, and this will decrease the blood returning to the heart, and the heart can only pump out what it gets, so this will decrease the uterine blood flow to the fetus.
Which we don't want.
which we don't want. We want that baby to get as much blood as they can. Okay, so the respiratory system. So a pregnant woman will breathe a lot more often with her lungs processing 40% more oxygen during pregnancy. As pregnancy progresses, the uterus presses up against the diaphragm and the lungs have less room to expand. Okay, so as baby grows, lungs get pushed up. It's harder to breathe. For this reason, the rib cage becomes more pliable in pregnancy, again, due to the hormone relaxin, and it allows it to stretch out and expand sideways and backwards, enabling more air to come up and in and improving the lung capacity. With that said, though, I mean, there can be a lot of discomfort. That was like one of my biggest discomforts, was up in the ribs and that movement up. I have a short space for a baby, so it was like, it did make it hard to breathe. So for me, like the side bending poses really helped, like just like Tiryaka Tadasana really helped stretch that area out for breathing and improving lung capacity. So again, keeping up with like the sun salutes gets more difficult. So it's really important to emphasize to a pregnant woman to really go at their own pace, because there's less room for the diaphragm to move. Yet the ribs are more open. Pregnant women should be encouraged to really breathe into their side bodies. Okay, so that's kind of what I was saying with this side bending. Another important thing to keep in mind is that poses should not be practiced with a rounded spine, okay, because that already kind of compresses the air. So always thinking about keeping that length in the spine. So if you're doing like a pose like Dvikonasana, keep the length through the front of the spine, as you come forward, so that again there's always space for baby. Encouraging space between the pubic bone and the breastbone. Okay. All right. The digestive system. Okay, so digestive system is also affected by the softening of smooth muscles around the digestive tract. The muscle tone is reduced.